news. A new poll is shedding light on the staffing crisis in Ontario's healthcare system. The survey found that 41% of Ontario's hospital workers say they dread going to work, and a similar number are thinking about leaving their jobs. More than 750 hospital workers from across the province were polled. The staffing shortages have triggered ER closures and delayed treatments. The poll was done by Nanos Research on behalf of the Ontario Council of Hospital Unions. More details are expected at a news conference this morning. Joining me to discuss is emergency physician Dr. Kashif Pirzada. Doctor, good morning. Happy New Year. Good to see you today. Let's talk about these new numbers. They show the burnout and the dissatisfaction among hospital workers. How do these numbers sit with you? Does it surprise you to see that over 40% of hospital workers say they feel dread going to work?
You know, it's not surprising at all. Like on a typical day, this is our busiest time of year. I go in and see 10 to 15 ambulances with paramedics trying to offload patients to a hospital that's completely full. It's not uncommon for these patients to be unstable, and you're constantly weighing these decisions. Like, do I give one bed to an 80-year-old with a heart attack or a 5-year-old with an asthma attack? You know, people don't mind hard work. You know, this is what we signed up for. This is what we want to do. It's hopeless work is the issue. And these decisions, these resource crunches take a toll. And you just don't want to do it anymore after a certain point. We have lifers who will probably do this forever, but we're leaning on them a lot. But we hire new grads, 3 to 4 months later, they're gone to an easier job somewhere else. So it's really hard to convince people to stay when all you do is struggle every day.
So the worker shortage has increased, it's more than doubled compared to 2018. Was COVID the tipping point, doctor? How do you see the change?
I think so. Like COVID represents a permanent increase in the amount of work that we have to do. Like now, this season is the worst is the worst time of year, but it's even worse now because COVID is out there along with flu and all the other bugs. There isn't a lot of promotion being done on the vaccine boosters for RSV, flu, and COVID that there should be. So we have a permanent increase in the amount of work we do, especially in elderly people, but we're not seeing the capacity increases.
Do you feel that the Ontario government, the federal government, is doing enough to fix these ongoing hospital worker shortage issues? What more can be done?
I don't think so. I think, the Ontario Auditor General mentioned an interesting solution in their report, which is to expand urgent care clinics, which are like mini ERs. Like, no one should be afraid to come to the hospital. Like, if you have that chest pain or that stomach pain that's bothering you, you don't have the training to know if it's bad or good. You shouldn't have to worry about waiting 10 hours to get seen. It should be an in and out visit, and we need to build a capacity for that, and we're not doing it. We've had years of in the COVID era to expand capacity, but we're not doing it. It needs to be done, and there needs to be investment in this area.
Dr. Pirzada, thank you so much for taking the time to speak with us today. Really appreciate it.